Hello, everyone, and welcome to another audio podcast in this series, the LabZtorm Impact v.2. It's another Storm Robotics production in collaboration with the Renal Patient Support Group, the RPSG, under this particular audio podcast. I'm going to talk a little bit about an overview again in relating to a topic that I have talked about in this series already a little bit, but I'm going to talk about this from a bit of a different perspective on in relating to primary healthcare records or primary care records. This was where I was invited to an electronic patient record seminar, and by a sort of an organization known as Ascribe, so I'm going to give an overview, a bit of an overview, but link this to some aspects that I've talked a little bit about already. So once again, this is the Shientist, and I'm going to talk to you. I'm going to talk to you about this. So generally speaking, Ascribe, or the Ascribe seminar that took place. This took place again retrospectively in 2014. Ascribe is generally an organization that has electronic patient records in and around different areas of primary care, sort of physician practices, or GP, general practitioner, general practice, and generally the seminar that took place, the Ascribe seminar that took place, invited different health professionals, or different professionals in areas of primary care, or and I was fortunate to be invited to be part of the panel, really, to talk a little bit about electronic patient records, having published some aspects around this particular subject entity. So at the Ascribe meeting, and this took place in an area in the United Kingdom known as Stratford upon Avon, and apparently Stratford upon Avon is that part of the United Kingdom, apparently, where Shakespeare sort of originated from, and so I'm going to talk a little bit about this. Generally speaking, as I mentioned before, I've mentioned a little bit about electronic patient records before, but just to place some emphasis. So although research has provided sort of valuable insights into the way patients use healthcare services, it is difficult to determine sort of the understanding of sort of the information and excuse me, the information across the across different illnesses, and this generally in primary care versus secondary care is more general, hence the name, sort of a general practice. Now, when it comes to looking at different illnesses and different sort of guidelines and practices that are in part with different illnesses, generally in general practice, what it means, or at least when this seminar was took place, was where Ascribe were highlighting different areas of how their sort of how their electronic patient record was easy to sort of was easy. It was generally easy to it was generally easy to use, and it was functional generally across different areas of different diseases. And so in line with that, Ascribe also talks about how in parts of their electronic patient record there was different areas of different diseases, depending on the types of these diseases or the different diseases. There was different ways where general practitioners could document different aspects of disease aligned to the care pathway, aligned to different care pathways. And generally, it is important to highlight. It has been retrospectively important to sort of gain a better understanding in relating to not just the types of diseases that are documented and linked to electronic patient records, at least from this seminar that took place back in 2014. Ascribe also highlighted things, areas of practice from sort of a pharmacy based side of practice as well. And generally speaking, there was at this seminar, there was some discussion around how sort of panelists have how panelists have sort of highlighted different areas of practice, highlighted areas of different practices according to different sort of remits around healthcare that they had been involved in. And on the panel there was quite a few of us, sort of members of the healthcare team, but looking at healthcare from different perspectives, but all having sort of a perspective that can be linked into areas of electronic patient records, not specifically, however, to the sort of the Ascribe electronic patient record, although the Ascribe sort of technology, or the Ascribe sort of electronic patient record was quite encouraging at that time. And so by implementing sort of integrated services, and there was some discussion amongst panelists and sort of members of the audience who actually attended this seminar, where there was sort of discussions around the sort of areas around integrative practices, and generally with Ascribe, and along with generally many other electronic patient records, healthcare and electronic patient records systems out there. Generally, everyone has a remit where they look to integrate practices in and around different areas of healthcare, not least general practice, but generally generally what we found was that alongside that, it also meant where at this particular seminar in 2014, there was not really much in the way of sort of lived experiences being shared around particular health areas of healthcare, and so the seminar was very sorry sorry, it was very much, sort of top down sort of approach in relating to healthcare practices, and so this led me into around the same time, and as I mentioned in one of the previous audio podcasts, it prompted me to contact some of the colleagues to collaborate on some work, and I've provided a sort of an overview in an audio podcast in this series about that, but generally what we found also was that understanding at this seminar was unfortunately the remit around the Ascribe seminar did not really prompt an understanding of how patients and the public access information, and especially considering where some patients may have issues around access to aspects that surround health, and in what was so, and also in line with this, it then prompted me to think about those the services that should be integrated into electronic patient records. So the Ascribe seminar talked allowed an overview of different areas of general practice and electronic patient records, but the current issues then in 2014 and still sort of in the current times, the issues are still where current practices is that they're apart from sort of lack of integration between different aspects of different health, different disease or different condition types. There still is issues and long-standing issues between health sectors where technology or electronic patient records, to be more specific, still do not actually allow or prompt a sense of integration where, for example, one patient could go to a general practice a general practice, highlight aspects that's going on, maybe given or prescribe certain areas, certain things as part of their disease, and then or that part of their disease, and then what will happen is that if, for example, that same patient goes to another a surgery or another area of healthcare practice between primary care or secondary care, that information that was documented in an electronic patient record at one surgery would not necessarily be identified at another surgery. What the patient has to do and what the patient will have to do, and this was mentioned across different panelists who were at the seminar in 2014, and where generally the patient would have to repeat aspects of their health or aspects of their health or clinical history or etc to a different when they go if they go to another electronic if they go to another surgery or between healthcare practices, between primary care or secondary care. So generally integration doesn't actually work unless unfortunately, where there are understanding health professionals and they're actually knowledgeable or there's an understanding by patients. And by that I don't mean just I don't mean just things in relating to empowerment and taking ownership and aspects like that, but also in relating to, and I did talk a little bit about this before, where there's still health literacy issues up and down areas of healthcare practices and between healthcare sectors, because generally speaking, health professionals do not want to have do not want that interaction with their patients, though they do boast that they want to be able to provide almost a construct that can help or provide patients with the sort of modalities to actually navigate aspects of healthcare. And even that being said, once it's been, if that was implemented, whether it would get documented, whether aspects whether aspects of that nature, and certainly it wasn't highlighted so much in the Ascribe seminar in 2014, but in the current times, whether anything that gets whether anything that in relating to health literacy or aspects of healthcare in context with navigating certain aspects of healthcare are documented by clinicians or allied health professionals in electronic patient records, still stands to be understood, and whether there's sort of a sort of a justification or application to actually implement that in electronic patient records. So basically, when this electronic patient records sort of seminar took place back in 2014, it was actually an opportunity for me to understand sort of the gaps in practice, but also how generally in general practice or primary care physicians sort of celebrate as somehow celebritize aspects of primary care without making iota of difference in aspects of healthcare, because generally in general practice, another aspect that links to this is where historically, unless within electronic patient records there are what are known as QOFs that are documented or linked, then actually general practice don't really care about patients. QOFs are basically abbreviated as quality as an abbreviation, in relating to quality outcomes framework, and basically that is quality outcomes framework is basically where patients, if they have a particular condition, then linked to that particular condition is a quality outcomes framework. If the quality of outcomes framework and general pathway around that is modeled and linked accordingly in context of electronic patient records, then that actually means that the general practitioners can actually use the pathway and actually get paid at the same time. So that's generally what electronic patient records in primary care are sort of substantiated to actually do. Hence why there's this remit generally that general practice, to do general practice is actually, whilst it's rewarding in some context, generally it's actually very easy to make money, for example, as a general practitioner. But then when making that money, for example, it doesn't actually help patient care, because the investment that general practitioners make is more about investments that benefit them than it does patients. Hence why there's literature and there is publications, sort of a volume of publications that link to issues around, again, as mentioned in a previous audio podcast, but also as published in collaboration with the Renal Patient Support Group, RPSG. There's still issues around health literacy where patients still can find it the most challenging thing, where they can't find or navigate aspects of healthcare, because in health professionals, where they should provide time, they do not provide time, and that is basically in relating to aspects of, for example, if treatment can be avoided or not necessary, practitioners should and could be more involved in prompting areas, not just of signposting, but actually sit down with with patients who have particular conditions, talk to them about the aspect of healthcare, and actually signpost to particular literature, evidence-based context, and actually go through that with them, and actually make sure that not only do they understand or comprehend, but actually seriously where they say that is actually the kind of that's exactly what I need. That's exactly what I've been looking for, evidence-based understanding, and I now know that I can sort of get into other aspects of healthcare through understanding the literature around that, because generally health literacy in a world or society where generally everything nowadays and perhaps for some time now is generally short, is more or less, or has been shorthand, which is generally how doctors or general practitioners generally annotate notes for patients who, for example, irrespective of whether they're from one background, one ethnicity or background versus another ethnicity or background, generally general practitioners are pretty much next to, unfortunately, dare I say it, but also with some sense of sadness. Really, is this the saddest thing, when actually general practitioners are being produced coming out of med school, for example, but actually when it comes to patient care, they don't actually really know how to provide that care, because the investments that they have made in aspects of medical practice are teaching them or prompting them to actually just really and dare I say it, only give a damn about themselves. Patients actually are kind of a tail point from them for them, which is why when it comes to QOFs or quality outcomes framework, which is basically pathways in linking from a clinical or medical conditions to the point where a physician gets paid. That's the only thing medics actually, unfortunately, that they generally consider. And whether it's because with relating to quality quality outcomes framework, whether they can actually see the physical amount of money that is a link to a particular quaff or particular condition, whether it's because they can see that, whether it's because they can see that, and whether that actually causes them less intrigue around patient care and providing real patient care. Who knows? It's whether who actually knows. And so basically the Ascribe seminar was actually one of those sort of times back in 2014 which highlighted to me at the time when I was on the panel. I was talking about, I gave the perspective in line with what the sort of the renal patient support group RPSG had been doing, and at that time the RPSG would have been sort of 5 or 6 years old, and basically in that time I was highlighting how patients and carers, siblings, generally everyone who still felt sort of disenfranchised or did not have place, or felt they did not have place to actually talk to general practitioners or healthcare professionals. They were actually using the RPSG, the Renal Patient Support Group, was for those kinds of individuals, and the RPSG is still growing, and now has an international sort of membership, and it still as I said, still continues to grow. And the issue is that in a way, let's be honest, I mean, online and social media platforms through different through and around different sort of disease or healthcare conditions, they wouldn't be so popular, or they wouldn't be so substantiated, for example, if for example general practitioners or other allied health professionals would be if they actually did their job very well. So there's that as well. So anyway, I wanted to give this overview because electronic patient records are generally healthcare records that irrespective of clinical condition or healthcare condition, electronic patient records generally are used to document patients' health, and generally there are lots of different electronic patient records sort of available, and I'm not here to promote. I'm not promoting anything, but I'm just highlighting the fact that generally healthcare records are electronic patient records have been around for a very long time, and discussion around them by different health professionals, different members of healthcare teams around in and around aspects of integration. The discussions by different members of the panel at the time were quite inspirational, but at the same time the discussions had been going on before 2014, and still have not, and health professionals have still not been able to sort of do that, and so this sort of overview is kind of an overview in and around different aspects of electronic patient records, and how certain health condition and the bases around those particular conditions can actually be where patients can actually do very well in relating to areas of practice if for example if for example, again, as mentioned in a previous in one of the previous audio podcasts, where there's neutral sort of places where patients and carers, generally speaking, can actually access informational support. I mentioned, for example, in the paper that had been published around the same time, around 2014, in collaboration with a few colleagues. Some from a couple of colleagues were actually from general practice, and another colleague was actually from the United States. And then there was myself, and we collaborated and talked about different areas of practice, but it was highlighted to me how, for example, library services would be really useful for patients and carers, as a neutral sort of neutral point where patients and carers and health professionals can access resources and implement focuses around different health conditions. And this is actually a sort of an area that I'm still quite intrigued by, and still haven't actually been able, general practitioners, because generally have been focusing very much on sort of developing areas of practices, generally do not unfortunately invest in aspects of those things that they are perceived to be those areas where they are perceived to hold dear, which relate to community or primary care medicine relates to community. Community is basically where aspects of library services could be useful, generally. And again, general practitioners sort of unfortunately don't know how to do that. So in line with that, and pretty much where I'm going to say a final few points on this, and that is that so back in around 2014, there was work by an author who highlighted that what can be learned from patients living with particular health conditions, is where healthcare professionals and carers can come together to kind of to talk about not just talk about, but but also learn from each other in a way where where generally speaking, again, where patients and carers, by having sort of that communication, there is informed decision making processes all the time, and where also where appropriate decision support by sort of well-trained health professionals are inclusive of general practice. And so importantly, more evidence had shed light on that people with low health literacy tend to defer and rely on health professionals to make decisions for them, and general practitioners know this very well, and generally those patients or patient sort of groups generally as a result have reduced health outcomes because of their dependency, and then people who are perhaps more proactive in care. And so therefore it comes back to the point where at the Ascribe seminar, whilst there was a good overview and remit about aspects of the electronic patient records and how there's possibilities where it can be integrated better, etc., etc., at the seminar, it prompted me to actually question certain areas around different conditions, not least around certain areas of chronic kidney disease or nephrology practices, but generally how how general practitioners actually again for example, dare I say it, and what I'm about to say is not just restricted to general practitioners, but generally all kinds of different health professionals. If they knew that there are different ways to invest their finances in a better way, where actually generally the society around them can actually benefit, then actually generally speaking that is actually where the entity around, for example, electronic patient records actually becomes basically where it is where the evidence, where it's lacking around electronic patient records, the investment would actually deem to actually liberate some of liberate some of those contentions. And so finally, I'm just going to say, and I have mentioned this. I have mentioned this before, but it is in keeping with this. And so by encouraging those sort of important partnerships and inviting and prompting areas of integrative practices, not least things like library services or patient and public involvement type research, for example, where patients amongst particular condition groups, health condition groups, can effectively and efficiently sort of add to important discussions. And this is now and was then and still is now it was then now and still is today, where GPs, general practitioners, and patients need to still have those important dialogues around different service entities that are aligned to community medicine or primary care, to prompt sort of tighter integrated services, and so that health and treatment, different areas of health and treatment would then actually prompt sort of expertise amongst different healthcare condition groups. But this additionally would also bring about a deeper understanding of public a sort of public domain entities, and also prompt sort of that interactivity that is so desperately needed still in areas of still so desperately needed in and across areas of medical practices. So generally, finally, electronic patient records, and sort of I mentioned this previously, so I'm not gonna make any additional emphasis. But an electronic patient record with and sort of efforts aligned to multidisciplinary team efforts. And multidisciplinary team efforts shouldn't just be health professionals talking with other health professionals and involving other health professionals. It should be health professionals and other different kinds of health professionals involving patients, and actually patients involving health professionals. And then and initiatives should be developed in a way where there are those sort of constructive sort of partnerships. And whilst I'm highlighting something that in part was talked about at this seminar back in 2014, it's no different now. So generally, it's important that those sort of things are encouraged and should actually happen immediately. It happened now. And so I want to leave this audio podcast like that. And so I'm now going to say thank you for taking the time to listen. This has been an audio podcast on around the LabZtorm Impact v.2. It's around the Ascribe seminar and the primary healthcare records around the Ascribe electronic patient record healthcare record, but also in line to other areas. An overview linked to electronic patient records, retrospectively. This has been the Shientist, and this is it was another Storm Robotics production in collaboration with the Renal Patient Support Group, the RPSG. And thank you for taking the time to listen.